Good afternoon. My name is Jacqueline Smith-White, and I'm the Prevention Program Manager at Henrico Area Mental Health and Developmental Services, and I will be moderating this conversation this afternoon. Good afternoon, panelists.
Hey, good afternoon.
Thank you for being with us. Please briefly introduce yourselves and briefly describe your recovery journey.
Hello, my name is Serenity. I'm 26. I've been clean for a little over 2 years. I've spent a lot of times in jail, recovery houses. Mental health, I think it was a really big breaking point for me, like the support that they brought. But, I'm just trying to stay clean, trying to stay positive.
Thank you.
Awesome.
Yes.
Hey, everybody, I'm Jason Alley. I work for the City of Richmond. I'm a policy advisor working on our opioid crisis response, which is really a dream job for me. I'm a person in long-term recovery. I've been clean for almost 8 years, 7 years and 3/4, something like that. But didn't enter recovery until I had been off substances for about 1.5 years. And it was really brutal and unproductive. So after doing a partial hospitalization program, I actually entered recovery, and my life completely opened up. And now it's what I do for my day job, and it's just an incredible thing.
Thank you.
So I'm Craig Swaney. I'm a physician. I work for Henrico County. I do addiction medicine. Didn't start doing addiction medicine. I'm trained as a medical oncologist, so cancer and chemo. But my recovery journey led me to addiction medicine. I've been sober, clean since December 29th, 2014. And there's no brief way to explain, I think, any of our recovery journeys, but what I'll say is what made the difference for me was finally letting go and kind of giving up on what I thought recovery was and trusting the people that were around me and trusting what they said and doing what they did. That led me into an experience in addiction medicine that I loved, and I got involved, and working in the field has been very good for me, and it's definitely part of what I do for my recovery, and I'm a strong advocate.
Thank you.
My name is Claudia Fleming, and I work with Henrico Mental Health and Developmental Services for the Pregnant and Parenting Women Case Management Services as a registered peer. I've been in recovery since July the 3rd of 2019, and briefly, my recovery journey has been just a process of changing everything about myself. Along the way, I have built relationships, most importantly, the relationship with myself, and learned how to live life without the use of drugs, one day at a time.
Thank you.
My name is Rodney Elam. I'm a father of 4, and life always turns you around a little bit. I have 4 children. One of them, she's a doctor. Another one, he's an officer on a destroyer out of Tokyo. Not out of Tokyo, but out of Japan. And then the other one is a college football player and got a big-time sales job, however you say that. But and then I got my daughter, Katie, who was sharper than all of them put together, the best looking, the smartest one of them all, and then she's the one that stumps her toe. And that happened when she was about 15 and 16, and 15 years later, we're still working on getting straight. We've been through 25 rehab facilities. She's given me 2 beautiful grandchildren, and I got another one coming on the way. But it's been a long struggle for anybody that's parents that has to deal with it. You know, sometimes you want to give up. Sometimes people say, "Well, why?" And then one of somebody says, well, why do you do all this? Well, if you're not going to do it, then who is? They're your family, they're your children, and you're going to stick with them. Somebody says, but it's been 15 years, Rodney. If it takes another 15, whatever it takes, just hang in there. And all the people, I hear doing stuff in the facility out here, all the stuff going on downstairs. God bless every one of y'all that helps my daughter along. If you help my daughter, you'll never be an enemy of me. You'll be a friend of mine for life. And so everybody's got a problem. Hang in there and try and work it out. All right.
Thank
you.
you. All right, so we're going to get into our questions. What was the turning point, the point that caused you to get on the recovery path? And anyone can start us off.
I think for me, the turning point, well, I got incarcerated and I found out I was pregnant with a baby girl, and I knew that I could no longer get high or, ruin another child's life. It was no longer about me. And that was the turning point. I mean, when you do it, people always say you have to do it for yourself, you have to do it for yourself. But in my case, I did it for somebody else, and that worked for me. So I'm just grateful.
Thank you.
I mean, kind of similar for me. I don't think about it so much as you have to just do it for yourself, as you have to be the one to make that decision. Because I'm also a father of 4. And I firmly believe that if I didn't have my wife and children in my life, I would have never stopped. I just would have continued to use until I drank myself to death or OD'd. But my wife and I had a second round of kids, and I realized that if I didn't do something, I was not going to see them graduate high school. And also, I just couldn't imagine living like that anymore.
Yeah.
It had just got to the point where it was just too brutal to continue to do every day. So yeah, that was a tipping point.
Thank you.
Yeah, kind of similar, but I wasn't pregnant. No, I had relapsed, and my disease had gotten me to a place where I had felt like my children were going to be better off if I wasn't around. And after I got sober, I was able to see just how twisted my thinking was. And I was just able to finally kind of let go and say, I know a lot about addiction and the recovery process, but I don't know the way to do it for me because I had not done well, And finally just saying, look, all right, I'm going to trust people. I'm going to trust my sponsor and my physician and my, therapist, and I'm going to do what they tell me to do, even if I don't think it's right. And I did, and it made all the difference.
Thank you.
I think for me, my turning point was actually going to treatment. And I didn't get it when I got out of treatment, but I thought that I could, use one more time. And it took me on a 6-month journey. And it was like, once you know that there's a different way, you can never use the same again. I think I used because I thought that was the only way. I continued to stay in it. And once I realized that I didn't have to live the way I was living, the consequences and repercussions of my actions, they hit differently. And so once I got incarcerated, I had some time to think, and I remember calling my mom, and my mom actually was the person that was taking care of my son primarily. And she was just like, when are you going to come and get your son? And when are you going to take care of your son? And for me, that was my moment. I had a time to pause and to breathe, and I actually decided to go and do some treatment inside of the jail and give myself some time to think about the things that were happening and really get the support that I needed instead of just sitting in jail, just, hanging out. I did some stuff in those 5 months. And so I definitely think it took consequences and then finding out that there was a different way. So, yeah.
Thank you.
As a parent, sometimes you're blind to your kids and what they do. Like at the Little League game, the guy's looking at his kid, you go, But I could never see it in my daughter, and the way I found out was 2 90-mile-an-hour speeding tickets when the police came knocking, you know what I mean? And then she got tested and stuff, and then I finally realized that was where my journey started. When I found out, when I opened my eyes up to, hey, you know, something's wrong here. And so that's where mine started. Somebody else had to tell me because I couldn't see it. You're blind to that.
Yeah. Thank you. So when you think about aspects that are most helpful to you in your recovery journey, please describe to us what they are for you. And that could be treatment, peer recovery home, self-help strategies. Just what are the aspects that help you in your recovery? Anyone?
For me, I would say what helped me the most was support. And it doesn't always have to be, you know, specific. It can be God or mental health or whatever it looks like. And I found it in mental health. I found a therapist and the support groups, and that worked for me. And it has continued to work for me.
Thanks.
Yeah, I mean, similarly, community is hugely important, whether that's through recovery meetings, whether it's through volunteer service, whether it's just being able to be with my family and be present is huge, but also the mental health piece. For me, I think for a lot of us, right, there's co-occurrence of mental health disorders if you have a substance use disorder. In my experience, it's one-to-one correlation. And I have some pretty sizable mental health diagnoses. And what I found was that the substances were not the issue necessarily with my mental health issues, but I couldn't address any of them until that was sort of out of the way. So for me to maintain my recovery, it's at least as important that I'm maintaining my mental health to the best of my ability. So for me, it's taking my medication as prescribed. It's making sure that I'm making therapy appointments. And part of those therapy appointments are also meetings, and all of that combined. But really, like working with that mental health component has by far been the most important part about my recovery journey.
Thank you.
Yeah, absolutely. I think you're going to hear the same thing from all of us in different, you know, ways. As a health professional, Virginia has all states, but Virginia has a Virginia Health Practitioners Monitoring Program, which is a monitoring program that's specific for any licensed healthcare professional. And part of the process is, hey, if you have a problem with drugs or alcohol, then here's what we recommend that you do. Those are recommendations, but if you want to keep your job or have a job, then you do what they say. And part of that was a 90-day treatment program, which was very good initially to give me education and support and some understanding, but also just being in treatment is good because it gives you a safe place where you don't have outside influences. It's harder, I mean, people use when they're in treatment, that happens, relapse happens in treatment, but in the big scheme of things, it's the safest place you can be to stay clean. That was very important. Access to, mental health professionals to treat co-occurring illnesses or diagnosis, whatever you want to call it. Taking my meds, that's been important. Meds are good for me, and I need to, stay on them so that I can make sure that I can, cope, essentially, to deal with stress. And there's lots of things that go along with that. Having peers who know what it's like. One of the things that I did wrong the first time around was I didn't have a good peer support. And having a recovery network, individuals that I talk with, throughout the week is important because, going to one person and saying, hey, this has been a really stressful day, and especially early on, you go to someone and say, man, this day really sucked, I'd really like to use. You get looked at a little different than if you go with someone who's got the history and you say, man, this day sucked, I really want to use. So the relationships are very important. And staying on top of my mental health, I don't have the luxury of being complacent I have to be intentional because there's too much at risk. You know, relapse happens. Relapse happens after, you know, a month, 10 years, 15, 20 years. Relapse is real. So, you know, I and everybody else in recovery has too much on the line to be complacent and not be intentional about staying well. And so I do a lot. You know, I take care of my body. I take care of my brain. I take it seriously.
Thank you. Awesome. Yeah.
Yeah, so like, you know, my peers said, I think therapy was like really important for me when I came into recovery. I had an amazing therapist that worked with me and just helped me and let me just, you know, cry and be who I was. Peers definitely helped me as well, and I definitely would agree with Dr. Swaney. It's nothing like having someone that can just normalize a situation that you think is absolutely terrible. Meetings, for me, church, a lot of different things, but I definitely would agree mental health is really important to stay on top of for myself. And so, yeah, I think all of it go hand in hand for me. I need community, I need supports, and everyone plays a vital role in that.
Yeah. Thank you. So I have a question for you, Rodney. When you think about advice that you could give to family members who has someone who's actively using, what advice would you give them as a family member?
I would say stay involved, don't ever give up, and sometimes don't look for the quick fix like some of these, the reason I speak to this, I'm a veteran of these rehab facilities that they send these kids to, children to, grown-ups to, and sometimes that's just a money situation. There's sometimes good friends, family. Sometimes family can be a problem too. How many times we heard a family member say, well, I would have done this, I'd have done that. You want to go, yeah, you know what I mean? And so it's not always family you can count on. Sometimes the friendships you see to work with. So I tell them to reach out to their friends, to the facilities like what y'all doing here. That has meant so much to Katie and the friends I see, she knows here, that's her support group. And I would just stay close and stay involved. And that's the main thing.
Thank you.
Yes, ma'am.
So what do you all think made the difference for your family members in regards to your recovery?
Boundaries.
Thank you.
I definitely think my family had to put up some boundaries and take care of themselves because I know a lot of my family ran behind me, tried their hardest, and until I was ready, I wasn't gonna give in to anything. So I remember my mom having to just stop answering the phone. You know, my family members, my siblings. I even remember my sister, who was a substance use counselor. She actually said, I don't know how it's said. I'm going to say it probably, inaccurate, but can't bring the horse to the water or something like that. But basically, like, she just was saying that she couldn't do it for me. So I definitely think boundaries was a turning point for my family because I realized that, I can't walk all over top of them.
Thank you. Anybody else like to share?
Yeah, I would say for my family, it was education. They, did a lot of, educating themselves about addiction and about recovery, and also helping themselves, doing work on themselves to know how to best help me in a kind of a healthy way. It was a big one.
Would you all like Jason or Serenity, would you like to share?
I think we all are having very similar experiences. I'll say candidly that my wife was really reticent to do the research and do the education on addiction because candidly, she rightly felt that she had spent enough of her time dealing with my bullshit, pardon my vulgarity. And I get it. And she said as much. Once she started to see the change in me, then she was a little bit more open to having discussions. Once that started working and she was in her own practice of therapy, yeah, we were able to be a lot more open about it. But yeah, I put her through enough. She really didn't have any interest. But thankfully, really to Rodney's point, is she hung in there. I'm not sure how or why, but I'm glad she did.
Thank you.
For me, so I see my grandma a lot blame herself and say she did all of these crazy things. And so I just would say, like, it's nobody's fault. It's not our fault. It's not our family's fault. I don't think it's anything that anybody has done or could have done better. So I would just say that to the family.
Yeah. Thank you. When you all think back to getting services that you needed, what would you say was one of the biggest challenges?
I was my biggest challenge.
Huh.
I had health insurance. I wasn't making a ton of money, but I had a job. For some reason, specifically chose not to seek any sort of help or care. I was lying to my therapist constantly, probably not even fully realizing that I was lying to my therapist, but there was no real relationship of like transparency and candor. So I was my biggest impediment. And it took a fairly catastrophic mental health crisis for me to finally be in a situation where I didn't have a choice other than to deal with it and look for services. And like I said before, that was my tipping point. And I had been sober for almost a year and a half. Yep.
Thanks. Go ahead, Claudia.
I would say my tipping point, right? Tipping point?
The challenge.
Or okay,
yeah.
Was definitely like the part where I like was in denial. Like I was definitely like my biggest block. I didn't necessarily want help in the beginning. I feel like I was prideful. I remember like my sponsor actually giving me suggestions and me actually being like, who does she think she is? So I was in denial. I didn't think that like I needed all these, these supports and all this other stuff. So I feel like I was the biggest block to get past. And here in my latter part of my recovery here recently, I think just realizing what really worked for me in my recovery, and I recently changed pathways to something that actually made more sense for me, and knowing that I could do that, which is now faith-based recovery.
Mm-hmm. Thank you.
Not the tipping point for me, but well, as a parent, I'm a railroad man, so we had good insurance. Alcohol and drugs is normal on railroad. So since my daughter was 16, you get in trouble, she go to rehab. She'd do the rehab, get out. A few months later, get in trouble again, go to another rehab. Like I said, numerous rehab facilities. And we did that, and I just kept going back and forth. And I think the tipping point was after we stopped doing the rehabs, and it got to the point where she hit rock bottom, and I think the thing that changed is being incarcerated. To me, that was, and it's terrible for a parent to say that, was I finally slept at nighttime when I know she was in jail, because I didn't know where she was at on the street, things going on, anything can happen to her. But when she was in jail, and you hate to tell people that, say, what's wrong with you? I said, oh yeah, well, she's in jail, I can sleep, I know she's safe. And I think that was a tipping point, and when she got in there, then she started getting the help from the county, and I think that's what has been the biggest turning point for her since that.
Yeah. Thank you.
Yes, ma'am.
So we've heard you all share about mental health. Would you like to tell us what you do to maintain your mental health?
For me, I think God plays a big role in how I maintain my mental health. And, like family, the mental health professionals, the therapists, the case managers, that's work. That's what, does it for me.
God's not part of my story, but that's okay. I have my own structure of belief, but short of that, exactly the same. A lot of it for me with the mental health journey is the same as the recovery journey. It's my participation in that process is directly correlative to my success, right? If I'm not going to meetings, if I'm not engaging with peers, other people in recovery, I may not return to use, but my behavior starts to get sketchy again and things get really weird. We call it crappy alcoholic behavior or whatever it may be. The same is true with my mental health process, but if I'm going to my therapy as scheduled, it helps a lot. Taking my meds as prescribed and not drinking and using through them shockingly helps. Who would have thought? But yeah, it really is about participating in my own recovery, whether it's the mental health or the substance use disorder part of it. Really just has to do with participation.
Thank you.
Yeah, I think participation's a big component there, and also making sure that I'm transparent, that I'm being honest with the people that are around me. I try to make sure that, I trust the people that are in my network. I trust my therapist. I trust my wife. And I'm open and honest with them. Sometimes that can be tough, but, it's what I have to do to stay well. I make sure I exercise. I make sure I've got a lot of kids, so I try to get enough sleep. Stay as balanced as I can. When I feel things, as time has gone, I've been able to do a better job at feeling when I'm not balanced, so to speak, and I'm a little better equipped to say, okay, I need to take a step back here and look at what's going on and make adjustments. That's been very helpful, so having some better self-awareness for sure. Medications, I do what my doctor says, I do what my therapist says, for the most part. And take it day by day.
Thank you.
I think for me, it really requires me to stay connected to God in prayer. I journal. I have a therapist that I talk to. I think it also requires for me to stay in contact with people in my community because I have people who can see me. Sometimes I'm not able to see myself because I'm in the frame, so I can't see inside of that picture. So I need others to point out things for me and to show me kind of when I'm, slipping or doing things that are, not conducive for my recovery. So it definitely requires a community, I feel like, as well.
Thanks.
I think your family and grandchildren, staying involved with them, staying active. And the other thing is also to have a core group of friends, and I've got a few buddies I've all my life, and they're real quick to tell you when you're doing something wrong. So you need that group that can just chew you out, and you go, okay, why aren't you doing this, Rodney? Why aren't you doing? But yeah, friends, family, children, and staying busy, I think is best.
Thank you. Please share with us the role of medication-assisted treatment in your recovery.
For me, it has not really played too much of a role. I've seen other people and it work miracles for other people. I've just never really tried it or wanted to. Yeah.
Okay, thanks.
I mean, if you consider my psychiatric meds as medically assisted treatment. I think they work great. Yeah, that's not been part of my story, but I'm a huge proponent of it, mostly because the evidence is there to back it. You know, it saves lives. And yeah, I'm incredibly pro medically assisted treatment. I think it's hugely important.
So I had an opiate use disorder, and there's multiple medications for opiate use disorders. Suboxone's a big one, Sublocade's another one. But I did Vivitrol. Vivitrol is a long-acting form of naltrexone, which is an opiate blocker. Binds to the opiate receptor and doesn't let go. It's a once-a-month shot. And it helps with opiate cravings and helps people's chances of staying sober. I was on it for 5 years, like I said, once a month shot, never had any issues with it. So it's kind of hard for me to say, what the role of it was. The role of it was I was on it and I'm clean, After the 5 years, the insurance changed and the cost was going to be like $1,000 a month, so decided not to continue it. But I can tell you for me, I, rarely had opiate cravings. I mean, cravings, I tell people this, and it's true for me, I think it's true for everybody, is that cravings are a normal part of recovery. Cravings to me represent stress. So, I had cravings, probably would have been worse if I wasn't on Vivitrol, but they happened and I was, able to manage them, very well. So it's part of my story, and I recommend it to folks when they're eligible for it. I tell people, hey, I was on this for 5 years, never really had a problem with it, and so on. It's a good medication. Worked well for me.
Thanks.
Mm-hmm.
I was actually on MOUD for about 3 months when I was in treatment before I actually, got back into recovery again before a lapse. So it worked for about 3 months, but when I tried it again, recovery again, I didn't necessarily feel like I needed to get on any MOUD, but I definitely have seen people's life be changed by it. So I think it is a very effective treatment.
Thank you.
I hate to go against some of the people, but I think some of the medicines they give, I think is terrible. The methadone, and I know it might be short term, but I can't tell you how many rehab facilities I've gone in with my daughter trying to get off heroin. On one part of the facility, they would be getting people off heroin. On the other part of the facility, they'd be getting people off methadone. So and like I say, I'm not a doctor. I can't tell what to do or not to do, but I think sometimes the medicine they give you, I don't know if it's the right one for the patient as far as just to keep things going. I just don't know enough about it to say it, but when you see them, it's just another way of it's another addiction to me. But y'all live it, y'all would know better than I would, but I just see people get hooked on methadone, hooked on with Suboxone, I think I'm saying it right, or what are some of the other drugs, and I wish there was a better way to get off without them. I just wish they could find one.
All right, thank you. So I have a question of my own. What words of encouragement would you give to someone who is still actively using?
I think that I would tell somebody still using that it's possible. I think using is a hopeless place, so people don't realize that it's so many opportunities out here and people want to help. So I would just tell them to get help. Go ask somebody.
Thank you.
That's a really hard question.
Yeah.
My typical response is to be informed and to be available and be support, and that's, for somebody who's using, I really just try and show love and compassion. I know for me that threat of losing everything in my life, including my life, didn't do anything to dissuade me from use. But compassion is key. And hopefully people, if you're compassionate with them and you relate to them in a way that's really honest and transparent, then when they are ready, then they know that there's someplace that they can go, somebody that's there to support. As far as what to tell somebody who's using, I love you, I don't know.
Thanks.
Yeah, that's actually perfect because what I do when I talk to folks is I really just try to say, hey, man, I'm glad you're here, and I really care about you, you know, because when you're in a place of addiction, it's just so isolating, and people feel, I know I felt, you know, so isolated, so alone, so just in an awful place. And, you know, I feel like my job as a provider, yeah, I do medications and all this stuff, and, you know, I talk with the folks that we work with, but our job is to tell people we care about them, you know, and that we're glad they're here. And when people, you know, slip up, make mistakes, it's the first thing I say, hey, man, I'm really glad you're alive. I'm really glad you're back. You know, and I say, look, this can be done. You can do this. You know, I know you can do it. Not to try to put pressure on people, but just to give them some encouragement. But really, it's, hey, I care about you, you know, and I'm glad you're here. So that's mainly what I try to do, is just show people that, hey, you know, you're loved and you can do this, and we're here for you in any way we can be.
Thank you.
Yeah, I would agree with everything that's been said. I think words of encouragement are very impactful. Of course, not trying to change anybody's mind, but just letting people know that there are, you know, supports out here and they are worth it.
Thank you.
Just like they said, knowing people care about you is the biggest thing, I think, to keep you going.
Yeah. All right. Well, I just want to thank you all. I heard the words of transparency, honesty, compassion, and I just want to thank you all for being willing to share your journey in such a transparent and organic way with us this afternoon. It matters that you're here. It matters that we learn from your experiences and from your journey, and I know that someone in this room needed to hear this information.